Hello, friends. I am Dr. Barbie Wasson with Riverpoint Family Acupuncture, and this is Riverpoint's podcast, where we get to the point on all things acupuncture, health, and vitality in the River Valley. Today, we have this month's riveting installment of Anatomy of Trust Heart Edition. We are talking about the system that quietly runs your entire life, whether you give it any credit or not, your cardiovascular system. If muscle is the engine of movement, circulation is the delivery system that keeps the engine running. Your heart and vessels are not background characters. They are the reason every other system you care about actually shows up to work. Most people hear cardio and think punishment, treadmill, gasping, maybe a little quiet resentment, or maybe not so quiet resentment. But cardio is not just a calorie burning chore. It literally changes how your body operates, from your energy to your mood to how long and how well you live. So listen up, because I am about to give you a newfound appreciation for those cardio sessions some of you merrily look forward to. Your cardiovascular system's job is to get oxygen, nutrients, hormones, immune cells, and waste products where they need to go. The heart is not just a pump. It's the engine that keeps every other tissue alive and functioning. When we do cardio, we are training that engine and the tens of thousands of miles of pipes attached to it. Every single cell in your body depends on that circulation. Digestion can extract nutrients. Muscle can store and use fuel. Hormones can be produced right on schedule. But none of that matters if circulation isn't delivering resources to your tissues and taking the trash out afterwards. This system is not optional. It is life in motion. At the center is that four-chambered heart sending blood through two main loops. One loop goes to your lungs to swap carbon dioxide for oxygen. The other loop sends that oxygen-rich blood to the rest of you. Arteries carry blood away from the heart under pressure, veins bring it back. And the tiny capillaries are where the real action is. Oxygen and nutrients out, waste products back in. Your body has tens of thousands of miles of blood vessels. Really, tens of thousands. Every heartbeat sends a pressure wave through that entire network every second, whether you're thinking about it or not. So, what happens when you actually challenge the system on purpose? Well, let me give you a little clue. Did you know that your heart is a muscle? And what did we learn happens when you work out a muscle? Can you guess? When you do regular cardiovascular exercise, your heart adapts and becomes stronger. Over time, it can pump more blood with each beat, so it doesn't have to beat as often to do the same job. That's one reason why people who train consistently tend to have lower resting heart rates. Blood vessels can adapt too. The inner lining, called the endothelium, gets better at regulating blood flow, relaxing and expanding when you need more oxygen, and tightening when you don't. And exercise increases nitric oxide, which is the key signal that tells vessels, relax, open up, let the blood get to where it needs to go. Better vessel function means better circulation and better oxygen delivery to your muscles, organs, and brain. Cardio also increases mitochondrial density. Those are your cell's energy producers. More and healthier mitochondria usually means better energy production and better metabolic efficiency. This is why, when cardio is done at the right dose for you, your energy level eventually improves instead of you just becoming a very tired person who owns some really nice sneakers. And then there's your brain. Your brain is extremely needy when it comes to oxygen and blood flow. And cardiovascular exercise increases blood flow to the brain and supports growth factors like BDNF, or brain-derived neurotrophic factor, which help with learning, memory, and your brain's ability to adapt. Movement also influences neurotransmitters involved in mood like dopamine, serotonin, and norepinephrine. So that clearer, calmer, I finally feel like myself again feeling after a walk, a ride, or a good dance around your kitchen, that is not placebo. You are not just exercising your body, you're actively supporting your brain and mood. On the metabolic side, cardio improves insulin sensitivity and helps regulate blood sugar more smoothly. It also improves metabolic flexibility, which is your body's ability to shift between burning carbohydrates and fats depending on what you're doing and what you've eaten. Blood sugar swings do not tend to stay in their lane. They influence a lot of things, including inflammation, hormones, vascular health, and how much usable energy you feel like you have access to. And then there's longevity. One of the strongest predictors we have for long-term health and lower risk of chronic disease is cardiorespiratory fitness. Not abs, not a specific number on the scale, but how well your heart, lungs, and muscles work together. And no, that does not mean you need to sign up for Ironman. Walking counts, cycling counts, swimming, hiking, dancing, rowing, chasing your kids or your dog, it all counts, as long as it's getting your heart rate up in a way that your body can adapt to. The goal isn't punishment, the goal is adaptation. Your heart adapts to what you repeatedly ask it to do. Chinese medicine looks at all of this through different language and lands in a very similar place, of course, because the body works how the body works. The heart system is said to govern blood and house the Shen, which is your consciousness, emotional regulation, and mental presence. Blood circulation is tied to lung qi, which helps move the blood, and liver qi, which keeps things flowing smoothly. When circulation is strong and qi is moving, tissues are nourished and the mind tends to feel more settled and clear. When things are stagnant, you might see fatigue, cold hands and feet, chest tightness, palpitations, anxiety, pain, mental fog, irritability, or slow recovery from stress and injury. Different words, same observations. Movement supports circulation. Circulation supports life. And how healthy that circulation system is determines the quality of that life. So, what does this actually mean for your daily choices beyond, I should probably do more cardio? It means that when you move in a way that gets your heart pumping regularly, you are strengthening your heart, improving oxygen delivery, supporting blood vessel health, upgrading your cellular batteries, helping regulate blood sugar, supporting brain health and mood, and increasing your resilience to stress, which we could all use more of. You are training your delivery system, not just checking off your workout on your to-do list. Pro tip on perspective, think of cardio as self-care instead of a chore and do it in a way you can enjoy. It will make your heart happy too. See what I did there? And for all my type A'ers out there, you do not have to do this perfectly. You don't have to earn gold stars, and you don't have to annihilate yourself. Consistency matters far more than intensity. Your body adapts to what you repeat, not what you do on one heroic Monday and then abandon for 3 weeks. This is not all or nothing. It's just something, whatever you can manage, more often. Now, let's bring acupuncture into this picture because you guys know I can't do these without bringing acupuncture in. And it just so happens that acupuncture is a surprisingly great teammate for your heart and vessels. Acupuncture can support circulation in the cardiovascular system from a different angle. We often see warmer hands and feet, less overall tension, easier recovery after exercise, and less pain when circulation and nervous system balance improve. From a Chinese medicine view, we say acupuncture moves qi and blood through the channels and supports the heart, lungs, and liver in keeping things flowing. From a biomedical view, we're likely improving local blood flow, influencing the autonomic nervous system, and modulating inflammatory signaling. This is also why acupuncture can be so helpful for things like chest tightness, certain kinds of heart palpitations that have been medically evaluated, and that my chest feels clenched even though my EKG is fine sensation so many people describe. By helping the nervous system downshift, relaxing the chest and neck muscles, and improving circulation, the whole area can feel less constricted and less reactive. And if you're recovering from a cardiac event and you're cleared by your doctor, Acupuncture can be a very supportive adjunct. It does not replace your current care, but what it can do is help with stress, sleep, anxiety around your symptoms, possible PTSD from the event, and muscle tension from moving differently. Also, it just helps with overall regulation that supports your body's own healing. So, big picture. Cardio directly trains the heart. Acupuncture helps the wiring and communication signals. Together, they can make it easier for your system to feel safe enough to adapt, regenerate, and heal. Next month, we're going to talk about bone density and skeletal health. It's going to be very exciting. We're going to connect the dots between digestion, muscle, circulation, hormones, and movement in building and maintaining strong bones. I don't know if you've noticed this every month, but each system builds on the last. Digestion provides the raw materials, muscle creates the demand, circulation delivers resources, the nervous system coordinates the whole kit and caboodle. When circulation is strong, your body becomes more capable of healing, adapting, and actually thriving, not just getting by. So that is it for this week's River Points and this month's Anatomy of Trust series. As always, with wishes of wellness and a lion heart, I'm Dr. Barbie Wasson, your resident heart and vessel enthusiast, reminding you that your 10-minute walk, your bike ride, and your slightly awkward living room dance party are all quiet love letters to your future heart and your future self.